0.
Welcome to the heart of innovation. 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhealth.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kim McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Hi, everyone, and welcome to the show. Actually, Dr. John Phillips is off on assignment, helping to spread awareness for peripheral artery disease, since it is Peripheral Artery Disease Awareness Month, or PAD Awareness Month. PAD, which is those blocked arteries and mainly the legs, a disease more prevalent and deadlier than most cancers combined. So he's off doing that. I'm in studio, and today we want to honor a doctor who has gone above and beyond to save life and limb for those patients with PAD in Canada, using advanced methodologies that most doctors actually across the nation have yet to adopt. Now, this is so important because the extent to which most doctors will go to try to save legs, for the most part, is just frankly disappointing, in my opinion, as is evident by the amputation rates across the globe, and is why there is a group of doctors and a film crew who are putting together a documentary called Amputation Nation to raise awareness of the amputation epidemic, which I'd like to actually share this clip that will set the stage for our conversation today and will drive home the importance of what the recipient of the Limb Preservation Excellence Award for Canada truly means. Colin, my producer, would you mind playing that clip from Amputation Nation?
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD, or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane.
The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options.
We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Wow. Just a powerful clip. I just have to shake my head every time, I hear this clip. It's one of those things that it is the reality. Hard to believe, but it is the terrible, terrible reality, what we're experiencing with peripheral artery these days. To learn more about Amputation Nation, go to amputationnationthemovie.com. It's so important, these efforts to spread awareness of what's fast becoming an amputation epidemic due to increased diabetes, chronic kidney disease, and obesity, coupled with lack of early diagnosis, lack of early treatment, and also importantly, the lack of adoption by doctors of advanced limb salvage tools and techniques. That's why I want to highlight those doctors and programs which are setting a new standard of care and putting patients first by exhausting all efforts to preserve limbs and ultimately their life. So I'd like to announce, as part of the 2024 Global PAD Impact Awards, the Limb Preservation Excellence Award in Canada, a prestigious recognition for outstanding contributions to the field of limb preservation in Canada, honoring an individual and his team for demonstrating exceptional dedication, innovation, and impact in their efforts to save limbs and improve the quality of life for patients with peripheral artery disease in Canada. And the award goes to Dr. Giuseppe Papia with Sunnybrook Health Sciences Center, Associate Professor and Chair of the Division of Vascular Surgery at the University of Toronto, and the J. Ross and Patricia Quigley Chair in Limb Preservation. Dr. Papia, thank you so much for all you do to save life and limb and to educate others. You're at a conference right now in St. John's, and you're out helping to educate others on new advanced limb saving techniques. Congratulations on the well-deserved award.
Thank you so much. That's very kind, and it is quite emotional, the video that I heard, because it is a traumatic experience for many people, and we are doing our best, and it's an honor for me to represent the group that I work with, who are fantastic and really drive this for everyone. And so to sit here and accept an award when I know it's the team and the group that we have at Sunnybrook, it would be a crime if I didn't acknowledge the fact that it does take a village, it does take a whole team. And, you know, I'm blessed with incredibly skilled partners, Dr. Andrew Dewick, who really got things going, and Dr. Ahmed Casey, who we were just chatting about, who is really our country's preeminent wound care specialist, as well as the people that mentored us, and they're phenomenal, Dr. Daryl Kusi and Dr. Robert Magisano, and we're all led by an incredible leader, Dr. Harindra Vujasindra, who allow us to push this envelope. So it really is the whole team that keeps everything going.
And coming up right here on the Heart of Innovation, we're going to have more with Dr. Giuseppe Papia to talk about their limb preservation program, how it got started, and what it means for patients in Ontario, Canada, and beyond. So stay with us. Don't go away. Right here on KDOW, the Heart of Innovation.
Leg health can indicate risk for heart attack, stroke, and amputation.
Sorry, not much in our first segment. It's usually me and Dr. John monologuing, which
No
you've got to
problem.
give him a really hard time for not being here and out playing golf today. But
well, listen, I'll tell him he's saving his own legs, so I get that.
Actually, I like the way you phrase that. It's probably true. His dad passed away, unfortunately, a couple of years ago.
Oh, no.
And so last year they started this inaugural golf tournament, and then so this year, so they're trying to keep it alive every year. And I was like, no, that's important. He was going to try and be there by the golf course, you know, on the golf course, but you know, we have a new sponsor and everything, and so we're trying to keep everything just clean and in studio right now. But he does
yeah,
send
well, saving legs on the golf course may have gone off a little differently.
Yeah.
But he's great, and you know, and you have to honor people that deserve it, and raising awareness happens everywhere.
Yeah, and you know, when you have your click in Canada, what we should do is we should go live with our radio show from there. And
sure.
Tell Dr. Johnny has to be there. But you know, it wouldn't be the same without Dr. Shannon Thomas and Dr. Anita Dua.
We got to, we're going to have to start small in Canada, but for sure, we'll try to bring them all in. Marco's done an amazing job, like a truly amazing job.
And do you think he'll come out?
Oh, Marco will. So definitely Marco and Mariano, and so we're just organizing to bring Marco as a visiting professor.
We got roughly 10 seconds till we're back on air.
Awesome. When is it?
In November. I'll share the details.
All right, live in 2.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. Dr. John has the day off to help spread awareness for PAD, since it is PAD Awareness Month. That's the only reason he gets a reprieve today. But I'm in studio here, and before the break, we announced the Limb Preservation Excellence in Canada Award through the Global PAD Impact Areas. Pioneering advancements in limb preservation techniques and technologies, significant improvements in patient outcomes and quality of life, contributions to research and evidence-based practices in the field, leadership in multidisciplinary collaboration and team-based approaches, which our winner, Dr. Giuseppe Pappia, was actually talking about right before the break. Also, commitment to patient education and community awareness, as well as advocacy for early intervention, so important, and comprehensive care and PAD management. Also, mentorship and education of the next generation of limb salvage specialists. That's really important. But I think most important is amputation reduction. The recipient of this award is not only met, but exceeded these criteria, setting a new standard of excellence in limb preservation care across Canada. And we are talking to the recipient, Dr. Giuseppe Pappia, the recipient of the Global PAD Impact Award for Limb Preservation Excellence in Canada. Again, Dr. Pappia, congratulations, well deserved. And
Thank you.
I really want to get to the heart of, who you are as a vascular surgeon. And, we're going to ease into how and why you started this program. But first of all, when it comes to vascular surgery, there's a whole array of different areas of the body that you could be focused on. Why PAD? Why the legs?
Oh, that's a very good question. So I would say serendipity, by accident, by good luck. It depends on which way you want to look at it. I went away to the Cleveland Clinic to work with.
For your patients.
Yes,
Definitely luck.
and for me, it's been an incredible journey for us and our team until now. But I went away to the Cleveland Clinic to learn advanced aortic stent grafting. And so I worked with the person at the time, Dr. Roy Greenberg, who was the innovator. He unfortunately has passed on. And I learned a great amount of techniques. And I returned, and I was ready to do all of the cases that we could get at our hospital. But when you start your practice, you don't have many referrals and many patients, and that particular problem is not a large problem. So I would do smaller cases to keep my wire and skills techniques up. And then what I noticed over time is that we would do one or two of these large, fancy aortic branch cases a month, but we started doing one or two of these smaller angioplasties a day, and then maybe a week, and then a day, and then 10 a week, and then it grew, and then it became apparent that there was a huge unmet need and patients that were in need of this care and this service. And so I took that opportunity to really kind of realign what I was going to do and look at this patient population that at the time was really not taken care of well, not whose needs were not met. And so I really embraced that. But I was lucky enough to have partners that felt the same way, because we saw that the number of these patients was colossal, really.
And why is that? Why are we seeing this just explode? Is it just because it seems like a disease that was considered an old person's disease, but now we're seeing it present in younger and younger patients. We had an article that came out in Science Direct here in the United States that was saying that we've seen a substantial increase in the number of patients between the ages of 18 and 28 first presenting with PAD in advanced stages through the emergency room with critical limb ischemia and wounds that won't heal. I mean, that's just crazy.
Yeah, I think we're reaching, there are multiple reasons, I think, and we are actually actively studying this. One of our scientists, great vascular surgeon and limb saver, Dr. Charles de Mestral at the University of Toronto, is doing big studies on our data in order to try to figure out, a population-based studies, which populations are most affected, rates, and just tremendous, tremendous work. But I think you're seeing a global rise because many things are happening at the same time. We have aging population, and that's all over. I think that we have a skyrocketing rate of diabetes, and probably also an increased awareness, which means we're capturing more patients. And then younger patients often have diabetes, and then really we have a greater interest of people that want to know why. So we need to figure out the answers.
Yeah, and you're certainly working on it there, and that I would imagine that with the increasing numbers, that's probably why you decided to start your limb preservation center. I believe it's the first of its kind across Canada that I'm aware of. Talk about the catalyst for starting this program and how it's evolved.
So, we started with the vascular part of it. We started with being able to do angioplasties and open up arteries, first below the knee and then below the ankle and then right up to the toe. And then we started with everybody who are innovating around the world, in Italy, as we were talking about, and in the US, more advanced techniques, and the generation of technology from using heart-based technology, coronary wires, things that were being done in the heart, and turning them down toward the feet, and as well as the companies making better versions for using them in the feet, developed, that we were able to treat more people. But that's an artery problem. So I'm a vascular surgeon. That makes me a plumber, and we're treating plumbing. But these are complex problems in complex patients, and you're not going to fix a complex problem with a simple balloon inflation, right? So they need their medical care, they need their offloading devices, they need to be able to quit smoking, which is incredibly hard to do. And sometimes I say to patients that the most useless piece of advice I give is you need to quit smoking, because most people know that they don't know how. And then diabetes, right? So diabetes is a skyrocketing problem, but it's a social problem, right? So people that don't have access to good diet, to good exercise, they have to choose between, paying their phone bill or their medicines, and that's a reality for many people. So this makes this as much a social problem as it is a medical problem. So without those added specialties, those added that added ability to treat those other things, you're not going to save the limb with a simple balloon inflation. It's just not as easy as stick a wire down there and inflate a balloon.
No, it's not at all. I mean, patients have to be really good partners in their care. I think that it's actually 80% the patient and 20% the doctor when it comes to peripheral artery disease, because there is so much that patients can do. And it's interesting because in our chat, we have Alan who's here, who's in Canada, and he says that he likes his doctor simply because he told him that he has to do everything he can to actually fix himself, and he would start talking surgery if it did not work. So he actually was like, you know what, I like the way my doctor there talked to me and said, you know what, you're responsible for your care. You can fix this yourself. It's your choice. And I do like that approach. But I'm curious, with your program, if a patient can't fix it themselves, or even if there is a portion they can fix, give us an example of a patient going through your program and what it's like. Demonstrate to us what it would be like for a patient going through your program.
So in our vascular limb preservation program, which is what it's called at Sunnybrook, the VLPP, we wanted to do two things. We wanted to take the patients out of the individual offices, or what I call the abyss of the fax machine. And so, general practitioner sends a fax to a specialist, and nobody really knows what happens, who owns the patient, and who coordinates the care. So we took the patient out of that kind of system and turn them to a system where they're in a program. So they belong to a program, and the program is run by a nurse practitioner. He's fantastic Greg. And Greg is not only a nurse practitioner with medical expertise who can treat, who can triage, and who can make referrals, but Greg is their navigator. And Greg has them in a program that has an algorithm that is an evidence-informed algorithm. And so first we screen to see if they're appropriate for the program. And if it's not a PAD, or if it's something else, or if it's a different type of wound care, we feed back to the referral what we think should happen so that it closes that loop. And then otherwise they enter our program. Now, the key thing about our program, it's not bricks and mortar really. It is a navigation outpatient program. And now there's one number that patients get referred to, there's an email, and then there's an immediate closing of the loop. So when we receive a referral, they'll receive a notice that has been received, and usually the patients are triaged within 48 hours. And then Greg will triage the patient, organize tests, and see the patient. And there's oversight of each of the vascular surgeons, but Greg is very independent. Also, Greg has become and is a wound care expert. So he does apply the wound care treatment. And I didn't mention that, but without wound care, it's impossible to close the wounds. And so again, a simple balloon inflation is not going to fix that. So what happens is for the patients, they're in our program and Greg becomes their referral point. So rather than running to the emergency department or running or trying to call an individual doctor office, they call Greg. And Greg knows our schedules, who has the earliest operative time, who has the earliest ability to get them in the cath lab, and we get them treated, and we get them through our wound care. He sees them together with the pedorthist. So if they need offloading devices, we help with that at the same time. And if they need infectious diseases or antibiotics, Greg also organizes that. But the great thing is when we heal the wound, they stay in the program. So they stay in a follow-up algorithm. And if they run into problems, they call Greg. And so that paradigm shift of having the patients in a program who is solely has a solely dedicated navigator, I think is a real shift in the paradigm of care.
And
we'll kind of right here on the Heart of Innovation.
Enjoy this and have more, but sadly we do have a commercial break. So without further ado, this is the Heart of Innovation with Kim McNichols and special guest Dr. Giuseppe Papaya here on AM 1220 KDOW. Don't go anywhere and do not touch that dial. We have more information to be spread to you.
Am I allowed to say papaya?
Papaya.
Not papaya.
No, papaya is a fruit. I don't think he was listening. Colin, it's papaya.
It's papaya. Is it being streamed on YouTube? My wife texted, said she can't seem to see it.
Oh, you can give her this link. She can actually jump in. Do you want to send her this link and have her jump in? It is on our YouTube, but she can jump in here.
That's okay. She doesn't need to see me.
It's yes, she does. Come on. Hey, Josh, can you put a link? I don't even need to ask. Look at this. He's already on it. Look in the chat. He just put the link.
Oh, great.
Okay. We can take questions. We do have a few questions. Marcel has a question. Tim or Alan have a question for Dr. Papia before we get into the resistance he faces with the program. Okay, so Kim has a question. We have about 5 minutes in this segment. So I was going to ask, what if Greg has the day off?
There is backup, and that's the old way, right? Through the vascular surgeons, we do have NPs that back up and provide care. And then, at most, Greg is off a day or two or a week, and
Hey, Lawrence, I'm going to need you to stay muted, please.
Let me get you the door.
Lawrence, I'm going to need you to stay muted, please. Can you remain muted? Thank you. Sometimes it accidentally ends up getting unmuted in a pocket. So where did you go, Dr. Papia?
I'm here.
Okay, good. It was just frozen with Lawrence's. It's sometimes hard when you have a live studio audience and the mutes unmute. So I'm so sorry to interrupt you. Go ahead. You were
No,
talking about.
there's always a backup plan when Greg is away for sure. And as the program's growing, and these things take time, they take a lot of time. And there's a lot of awareness that needs to happen. And I know that there's a feeling probably by patients affected that nobody knows what's going on, but we're not at the level, especially in North America, of awareness like heart disease and cancer and other things. We're just not there. But I do believe that the time has come for this problem. And so that's good.
You know, I feel so blessed to be a part of this, this disease state right now, because it is just so exciting, all of, the innovation that is happening and people like you, raising your voice and creating these amazing programs and helping to create the change that patients have long wanted to see. 10 seconds?
As of now, it'll be 2.
Okay, Marcia, then Kim.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. Dr. John Phillips has the day off. And we are talking to Dr. Giuseppe Papia, recipient of the Global PAD Impact Award for Limb Preservation Excellence in Canada. And we have quite a few questions coming in from our live studio audience for Dr. Papia. I want to start with Marcia in Ohio. Marcia, go ahead and unmute and ask Dr. Giuseppe Papia your question.
Thank you, Kim. And congratulations, Doctor. Quite an honor.
No, thank you.
Yeah, I was just wondering about the skyrocketing numbers that you were referring to that you saw. And I'm wondering if the way society has changed, like when I was a kid, and I'm old, but we were kicked out the door in the morning if there wasn't school. And if there was school, a lot of times we walked. We got home, we played, we did sports. And during the summer, it was like, go on, go play. And we didn't come home until either dinner or the street lights came on. And that whole time we were active, swimming or biking or, playing games. And now, I mean, even grownups don't have to go to the grocery store. They can sit at home in their seat and order all their groceries and have them delivered. And so and that might also, I'm curious, I'm asking, be a factor with diabetes, but also the lack of exercise contribute to the numbers you're seeing.
Well, absolutely. I think that it is a package, right? So a sedentary lifestyle, and then probably poor diet. Maybe, if you add tobacco onto that, or in Canada, cannabis, it's legal. And so, it's treated like tobacco almost. And so I think it is a package deal. I think you bring up a great point that having lifelong health starts when we're young, and really getting people moving and active is a lifelong lifestyle, because this doesn't happen overnight. PAD and really type 2 diabetes is a progressive problem over time from, really lifestyle choices. Now, I will acknowledge some people don't have a choice or have less of a choice in terms of their socioeconomic, ability to make better choices. But I think that keeping it simple, keeping people healthy is the key. Keeping people away from me and, making my specialty irrelevant is the key.
Fantastic.
Thank
Kim,
you.
go ahead and unmute. Kim, you're actually located in Canada. What is your question for Dr. Papia?
Hi there. I have PAD and CAD, and I'm on 2 different statins, and I'm just wondering, is there a point when your LDL numbers on your blood tests become too low?
So that's a very good question. And for full disclosure, I leave the medical management up to our cardiologists and our medical team here. So it's not something that I could really give you a real answer on, but I do think it's something you need to follow up with whoever's managing those medications. There are medications that we recommend people with PAD to be on, antiplatelets, statins, and that show a benefit. But I also acknowledge that they all have side effects that need to be managed and watched and followed very closely. And so as a vascular surgeon, I make those recommendations and let the medical doctors follow them.
I also love that you send them to the cardiologist. So many doctors around the world, so many vascular surgeons send the patients back to primary care, and primary care doesn't have the advanced experience in the anatomy of the vasculature and understanding of current research trends when it comes to some of these medications. And so I do like that you do send these patients to a cardiologist who have more experience in managing these medications. So I really do like that. I also wanted to say that, you know, when it comes to statins, what I learned from actually one of our mutual friends over in Germany, Dr. Michael Lichtenberg, he was actually saying at one point that you have to be very careful when you're a vascular path in that you have these ranges for normal people, and there's a whole different range when it comes to people who have vascular and cardiovascular issues. And so you have to look at that. And so, yes, it's going to be on the lower end of the normal and even well below that. But you should really check to see what the range is for a vascular path because it is different. We'll come up right here on the Heart of Innovation. We're going to have more with Dr. Giuseppe Papia and their limb preservation program in Canada. We're going to talk about resistance to the program and see how he's overcome it. So stay with us. Don't go away. Do you like how I prepared you for what I'm going to,
Yes.
Ask the tough question yet
Yeah.
next?
And feel free to tell me to stop because I have sometimes I get going and I'm very passionate about this. So, but the truth is about the cardiologist, and they have, if you have peripheral arterial disease, by definition, you have coronary artery disease. There's no downfall for that. I don't blame. I think we have great primary care practitioners, but they're also inundated with every other diagnosis. So we have that added ability in the fact that we live in a big heart program. So we take advantage of it.
Yeah, no, I think that's amazing.
But we're in a big university center, right? To judge everybody based on our huge amount of resource is unfair. I'm going to say that offline, right? Because it's not fair for someone in a remote community doing the best they can with what they have to be judged by like what we have. You wonder how we're not doing better.
Well, I'm still going to judge them. I want them to all be like you.
Yeah, there's a real push in the community to do this all over the province, which is great.
Yeah, I think that's amazing because we just have patients. But it's interesting to me because I even have patients in Ontario that they have to wait 2 years to be seen.
By a vascular surgeon?
Yeah.
That to me is unusual, and I don't know where that the issue is there in the referral based, communication based, sometimes travel. So I'd like to unpack that a little bit, but I would say is unusual.
Okay, well that's good. When I hear from that patient again, I don't know what their actual
like if they live remotely and want to see someone closer to home, sometimes that could be an issue. If there are travel issues, there could be multiple issues there. But to wait 2 years to see a vascular surgeon, I think would be way out of the norm. I couldn't imagine that they would be on a wait list. They might not be alive in 2 years. Like really. So there must be more to unpack there.
There probably is. She was just like, I don't understand. I said, well, the good news is you're in the early stages, and the good news is you found us, and we're going to get you on our walking program. And so far, she's doing great. So, could just be, one of those things. It is early stages. And I heard that there's also a problem in some areas of Canada where, the primary care won't even refer to a vascular, where they're just like, you're not bad enough yet to go see a vascular. And I always like a patient to at least see a vascular for better assessment because you ask different questions, and most of the time than primary care.
Yeah, and awareness is half the battle. I mean, if you
Yeah.
asked the average person if they knew having diabetes and having a toe ulcer was worse than breast cancer, prostate cancer, and colon cancer combined, they would their jobs would drop. But I think most physicians in primary care don't know those stats. So it's not their fault. It's our fault for not getting that information out there.
Yep. Yep. It's true. So we have about 4 minutes, 30 seconds in this particular segment. So it's pretty short. And then we'll
Okay.
have one more 4 minute 30. And we take a few minutes after the show. I have 3 very deep questions for you. And then we'll let you
Okay.
run.
All right.
It's for, other series that we have working on. So it's to maximize your time here, and you end up in a few other shows with some of your cool cases. So I think I
Sure.
sent you the questions. There are 3 deep ones, the last 3 on the list.
Good. As long as they're not live.
They're what?
As long as we don't do it live, I'll give you, all your answers and you can edit.
Oh no, then you're gonna make me work. I expect perfection. I'm
Glad
just
to see the
kidding.
smiles on people's faces. Just a heads up, it's going to be roughly 25 seconds till we come back in.
Okay. We're gonna focus on the resistance,
Okay.
if you don't mind. The challenges you faced.
Yeah.
And maybe give us an example and how
All right,
you've
everyone,
overcome
10
it.
seconds. Live in 3, 2, 1, 0.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. Dr. John Phillips has the day off. It's Peripheral Artery Disease Awareness Month, so he is off saving some piggies. So very, very important work. I'm here in studio with Dr. Giuseppe Beppia. He is the recipient of the Limb Preservation Excellence Award in Canada. He and his team have put together an incredible program with proven amputation reduction in their area. So we're going to be talking about that. Thank you so much, Dr. Beppia, for being here. I would
Thank you.
love for you to first talk about just the proven amputation reduction because of this program that's been implemented by you and your team.
So, I mean, we'd like to have hard numbers on that, and those are coming. The program is very young. We're in our 3rd year, but we're really in our first year of establishing the program after a demonstration project, and we are following those data. They're really hard to get in the way we have it structured, but I could tell you that personally, anecdotally, the patients we've managed to help palliate pain, to minimize or completely eliminate amputations has been tremendous for everybody in the program. So, I can't give you a number reduction, but we have patient stories that will tell you what a tremendous experience they've had. But it is, and this is part of the challenge, it is a lot of repeat business, if you will, right? It takes a lot to manage limb preservation with repeat procedures, with vigilant follow-up, and with all of those multi-medical, disciplinary care that the patients need. And so that's part of the program, which is really evolving and is fantastic.
Well, so what challenges have you faced in implementing a more proactive approach to PAD treatment, given that many vascular surgeons in Canada tend to wait until wounds won't heal before addressing the situation?
No, I don't think it's. I wouldn't put it that way, Kim. We get what we get as
It's
a
just my
referral
experience.
base, right? So it may seem that we wait till there's a wound, but that's often when the patients get referred, right? And then so they may be managed, they may be aware or in the community from their primary care physician, and when there's a wound, and then they get referred, and we want to get them earlier than that. But what we,
Right.
that is an awareness issue. And I think vascular surgeons in Ontario are very engaged in this. I know that the government is very engaged in this. So we have, the ministry has Ontario Health. It's led by Dr. Barun Kapila, and they have put out seed money for different limb preservation strategies at different hospitals. We're currently devising CLTI guidelines for the province, and I'm chairing that. And it's very exciting because that will form the basis of how we move forward. So, our vascular surgeons are incredibly engaged. But, when people don't know there's a problem, it's up to the people that do the work to make that awareness. If you ask the average patient that has diabetes and a toe ulcer, or just ask the average person if they know somebody with diabetes and a toe ulcer, they won't know that that situation is worse than breast cancer, colon cancer, and prostate cancer combined. That half of those patients won't be alive in 2 years. And if they are, if they make it to 5 years, 75% will have an amputation. Now, that's the public not knowing that information, but I don't think we've done a great job telling our primary practitioners that information. So I think that it's on us for that. And I think there's a great excitement in generating these guidelines and in creating a system that is scalable and reproducible, much like the cancer programs that we have, right? You can't cure cancer with one program. It would be great to have limb saving centers all over the province, but we have to start. So I think I'm very excited where this has gone to and where it's going in the province of Ontario, but it takes time.
Are you facing any resistance?
Well, there's always resistance to.
Here on the Heart of Innovation on AM 1220 KDOW. I hate to do it to y'all, but we do have to do these commercial breaks.
I wish there was like a finger up or something.
More.
No, he puts in the he puts
it's in the chat. Let me keep the chat open. Okay, so I'll know when to get down. But
it was my fault. I didn't see it. And I asked you the question, so I set you up to fail on that one.
That's all good. But we are seeing a positive movement forward. So I'm going to tell you right now that I'm going to be non-negative on anything you ask.
No, that's it. That's good. I mean, I think that's important. I'll just say before the break, we talked about, I asked you about, resistance. But keep it short. Just, with any new program, it's actually been a long time. It's been a long time coming. I think people actually want something like this. They needed guidance, and I think that's interesting.
So
and Kim wants.
Yeah.
No, Kim wants to know, is the U.S. more advanced in treatment than Canada? And I think that there's still a frustration that you have, but you're more. The U.S. is more advanced in terms of adopting newer tools and things like that. The atherectomy devices are slow to come about. What are the atherectomy devices that you have? I think you have a
We
laser.
have them all. We have them all. We have all technologies. We are probably, because we are funded by single payer. So the difference really is everybody thinks it's a social system. That's in Britain. We don't have a social system. We have a single payer system. That single payer is the government. So there has to be a proof of case. It is case by case. We have access to everything. But the truth is, there are no great